Hey, Bo, Sarah, Isabel, and Joshua. Jennifer here, your instructor for the pharmacy practice course, and I just wanted to talk about your post-traumatic stress disorder report today. I really enjoyed reading your report on PTSD. I can tell your group put in a lot of work into researching the topic, and I think you worked really well together as a team. Just wanted to go over some of the points to give you guys some feedback. So here, let's start with the introduction. I think you've got a really great introduction here that draws the audience into the history of post-traumatic stress disorder using the story about medieval knights. And then you move into what I think many people think about when they think about PTSD, which is soldiers and veterans who have gone through war. And this helps draw the reader in and use some of their pre-existing knowledge that they might already have about the medical condition before reading more and learning more about the topic. I think that you've got some really interesting statistics here in the incident section that compares the general population in the United States versus the general population in the United States, as well as women versus men. So that's really great. Under causes, you do a really great job elaborating on the fact that it's not just war that causes PTSD. And there are other traumatic events that can cause PTSD to manifest. So things like serious physical injury, being witness to natural disasters, rape or other physical assaults. So this helps expand the reader's definition of what PTSD is and who can be affected by it. Your prevention section here, as well as your treatment section down here, highlight that there are non-drug related measures as well as drug related measures that can be used to treat or prevent PTSD from happening, which is what I wanted to see. I think it's really important that patients understand that mental health requires a more holistic approach to treat or prevent it rather than something as simple as just taking a pill. So I think you guys do a really good job highlighting that here. Your conclusion is a great summary of your report. Your references are reputable down here, and you've sourced some really great journals. So overall, I think you've got a really good report here. My job as an instructor is to help you be successful as a researcher as well as a writer. So I have a few suggestions that you can use to build upon the strong foundation that you guys have created so far. Let's start back up at the top with your introduction. I think it's really interesting, but could be shortened a little bit to be more direct and clear. It's sort of meant to pull the reader in and then give them a brief idea of what the report will be about without sharing too much. I think right now you've shared a few points that could kind of wait later on to be left to their individual sections. So I think that this section here, as well as these two sections here, could probably be cut out from the introduction and then just talked about when they get to their individual sections. There's a sentence in the beginning, the first sentence here, that says that it's a mental health condition that affects 6% of the population. I was just wondering, is that 6% of the world's population? Is it 6% of Canada's population? Or is it BC's population? Because I see the reference is HealthLink BC. So maybe just clarify that line there. I think your incidents section is really informative, but I noticed that a lot of the statistics are about the United States. I would be really interested to learn about the PTSD numbers in Canada, since most of our patients will be Canadian. A little bit lower under prevention, there's a really great study here that drew my attention. This one about adrenergic agents such as propranolol after a traumatic event being used to decrease the risk of developing PTSD. I was wondering, is there any more updated research about this? You've got this study here from 2002, so about 20 years ago. So I'm wondering if there have been updated or recent studies that support this use. And then lastly, under treatments here. Treatments, you talk about SSRIs being used, right here, SSRIs being used to treat PTSD. I would recommend expanding this section a little bit to educate the reader more about this really important class of medications. So think about, how does this medication work in terms of pharmacology and therapeutics? What side effects can patients expect if they were going to start this medication? How long do they have to be on this medication for, etc.? Conclusion is great. I like it the way it is. Under references, I think you've got a really comprehensive list, but there are a few small formatting issues that I think can be quickly fixed. So first of all, your references don't need to be numbered, so they can just be listed alphabetical order. Under each reference, there should be a hanging indent after the first line. So maybe just fix that formatting there. And then lastly, I notice about halfway between number 14 and 15, it switches font. So I would keep it consistent just for a more professional look. Overall, I think the report is really well researched and interesting to read. I think it flows well, as if it was written by one person as opposed to 4 individual writers. So that's a really strong reflection of the time and effort that your team must have spent editing the report, and the great communication within your team while working on the report. I encourage you guys to take some time to discuss amongst yourselves as a team about the items that I mentioned, and hopefully I've given you guys some ideas to build upon further to make this report even better. Thanks for your submission, guys.